more from Women and Girls with Autism Spectrum Disorder by Sarah Hendricks. I'm going to do chapter 12, which is on pregnancy and parenting as a woman with autism, and 13 is health conditions. In the series, I've mostly been reading passages that I know I relate to. I have never been pregnant or had a child. I do hope to conceive next year. So for chapter 12, I'm reading a combination of just basic stats that I found interesting and passages that I can foresee myself relating to. Around half of women who were questioned for this book had children. Most had at least one child with ASD and or other developmental conditions. Pregnancy is an exciting and overwhelming experience for any woman, but for a woman with autism, the experience may be somewhat more intense. She will have to cope with feeling completely out of control of her body, which changes almost by the day. She also has little control over the process that needs to be adhered to. There are appointments, new people, and plenty of physical contact from strangers, both those needing to perform examinations and random strangers who feel that touching a pregnant woman's stomach is acceptable behavior. That's so icky that people do that. New passage. Typically, some women with autism take on pregnancy as a special interest and devour every scrap of information that they can on the subject. That'll definitely be me. Many women writing on the subject of parenting with autism describe feelings of inadequacy and thinking that everyone else is doing a better job than they are. I can foresee that being me. This is somebody's anecdote. I took motherhood very seriously and wanted to do it to perfection. Parenting to me has been a project like any other with outcomes to be successfully met. My views of bad parenting remain vehemently strong. I think it is one's duty and obligation to not harm a person that one chooses to bring into the world. I feel that I have failed substantially to be a perfect parent, although this is partially because in the early days I didn't know that this wasn't possible, or so I'm told. I tried very hard to get it right and continue to do so. That's all for chapter 12. As I said, chapter 13 is on health and well-being. I was really surprised that this chapter did not mention EDS. This book is, I think, 10 to 15 years old, something like that. So maybe we didn't know at that time. But there are now studies that range from, I think it's like roughly 40 to 70% of people with Ehlers-Danlos syndrome are on the spectrum. I have EDS. Almost twice as many women with autism experience PMS symptoms than non-autistic controls. Another study found that women with autism showed higher frequency of epilepsy, PCOS, and atypical menstruation, and severe acne than the control group. So from those, I have epilepsy. I don't think I truly have PCOS, but I did have an ultrasound of my ovaries as a kid, or as a teenager, because for several years after I had started menstruating, I still was having very irregular periods. I would have multiple in a month and then go a few months without any, and they were kind of all over the place. And usually they say after, I think it's 1 to 2 years of getting your first period, they are supposed to become more regular. So I had an ultrasound. I did have cysts on both of my ovaries, but I was supposed to go back 6 months later to see if they had removed themselves. Because as long as they come out or dissipate or whatever it is that they do, then it's not PCOS. I lost my insurance, and so I never did that, and I have never had my ovaries in an ultrasound since then. But I don't have really terrible periods or any other symptoms that have made me super worried about that, so I don't know. It has a section on eating disorders, but it talks mostly about anorexia. Maybe, again, this is perhaps a really new thing, but we now know that ARFID is really linked with autism. I don't know for sure if I would qualify as having ARFID, but I am a lifelong picky eater, and the primary reason why I am a picky eater is texture-based, sensory-based. I feel like I'm not so picky that I am unable to get all of my nutrients or whatever, but it is limiting enough that it is very stressful and anxiety inducing to go to a restaurant that I'm not familiar with or to eat at anybody else's house. I kind of need to have a high level of control over what I eat because what I eat is limited. And it's not preference based, it's I can't make myself eat a lot of things. I would and have and will again go hungry rather than eat things that I have aversions to. Depression. Depression was mentioned with around 50% of women questioned, and the author says, from my experience, I would suggest this figure is likely to be even higher across this population. The experience of feeling different, excluded, and living in an unjust world, yet having no means to fix things, is so common to people with autism that many perhaps do not even relate to the term depression. It's just life. Many women with autism that I have worked with describe themselves as having been depressed forever, and that their low mood is simply a consequence of their limited social acceptance and daily challenges. They were unable to differentiate their depression from their autism. Problems with identifying emotional responses, alexithymia, from physical sensations can form part of this difficulty, as they may not actually know how they are feeling and or be able to articulate that into words. I was diagnosed with depression at 13 or 14. I was reassessed almost 2 years ago now and was found to not qualify for depression anymore. I had clinically normal levels of depression, whatever that means. Anxiety. Anxiety is widely recognized as being a normal part of life for many on the autism spectrum. I feel like I was kind of born anxious. With both of these, and I guess so many other things, it is hard to know what's what, because I also have a not insignificant amount of trauma that I think strongly correlates with depression I had in the past and with anxiety that I have always had. But I also know it's not usually as simple as either or. It's often a mixture of both. Self-harm. People self-harm in different ways and for different reasons. We have mentioned in the sensory section about how finger and skin picking, scratching, rubbing, and plucking hairs. How an individual chooses to frame these behaviors is a personal one, but perhaps the line between a sensory comfort and self-harm is a blurred one. Mothers of girls with autism report self-harm as being a particular concern. In a 2012 study, my understanding is that girls and women with autism self-harm as a means of feeling something real in the pain in times of overwhelming emotion. Study done on self-harm, that there was significant differences found in people who start self-harming in adolescence or later versus people who start self-harming as younger children. When it's in adolescence, it is usually more of a direct correlation to trauma or mental illness, where earlier in childhood, it usually has a sensory component to it as well. I started at about 7. Somebody's anecdote related to this that I found relatable. This might be triggering for people who have a self-harm history. I couldn't attach any words to my feelings, and put simply, I didn't know what to do with them. I couldn't speak up about them as I had no words for them. This is called alexithymia. Breaking my skin and channeling the feelings into physical pain somehow diverted my attention into something solid and tangible and made them dissipate. That's all for this one.